Welcome to the deep dive. Today, we're really digging into something fundamental for modern healthcare practices, their financial health.
It's a big one.
It really is. Think about it. Your clinic provides absolutely essential services, sometimes life-saving ones, right up front. But then comes this long, often unpredictable period before you actually get paid. Weeks, maybe even months.
It's a tough cycle.
It's a real paradox, isn't it? Giving the care immediately, but the revenue trickles in much, much later.
Yeah.
So our mission today is to explore how a financial tool called accounts receivable factoring might just be a strategic shortcut.
A shortcut to what, exactly?
To getting cash flowing immediately, streamlining your operations, and ultimately building a healthier financial base for your practice.
Okay.
And for this deep dive, we're drawing heavily from a really insightful article by Blue Barn Funding that focuses specifically on these benefits for medical pros. Right, so let's unpack this first part. Why is cash flow such a persistent headache? What's really going on behind the scenes in a typical practice?
Well, it really boils down to a few core issues that are pretty unique to healthcare. First off, you've got the insurance reimbursement maze. It's a labyrinth.
Maze is a good word for it.
Seriously.
Yeah.
Claims processing can take weeks, sometimes months, and it gets messy with denials, underpayments, having to resubmit things.
Oh, the resubmissions.
Exactly. And every single insurance payer has its own set of rules, its own coding quirks, ICD-10, CPT codes, all that detailed stuff for diagnoses and procedures.
Right.
Plus different payment schedules. It just creates this incredibly unpredictable income stream. Makes forecasting cash almost impossible sometimes.
Okay, so unpredictable insurance payments. What else?
Then you've got the rise of high-deductible health plans. This means patients themselves are responsible for a much bigger chunk of the bill.
Right, that seems to be everywhere now.
It is. And collecting those balances directly from patients, especially after insurance has paid whatever it's going to pay, it's incredibly time-consuming, resource-intensive.
Your staff must spend hours on that.
Countless hours chasing down often pretty small amounts. And frustratingly, a lot of it just ends up as uncollectible debt, bad debt. And speaking of staff time, think about the administrative overhead. Just the sheer cost of having people dedicated to billing, coding, sending out claims, following up.
It's a whole department, basically.
It often is. It demands a big team, significant resources, and that's capital and manpower that could be going towards, actual patient care or growing the practice.
Makes sense.
Then layer on top of that the unexpected costs. Every business has them, right?
Sure. Equipment breaks down.
Exactly. Diagnostic equipment needs repair, or suddenly there's a new hypo regulation you need to comply with, costing money. These things can just drain your cash reserves unexpectedly. And finally, even good things like growth cost money up front. Expanding to a new office, investing in that fancy new MRI machine or EHR system, hiring more doctors or nurses.
All needs capital.
All needs capital that's often locked up in those unpaid invoices we talked about, those receivables.
Wow. So putting it all together, it really paints a picture of this significant gap, a delay between doing the work, providing the care, and getting the money in the bank.
That's the core problem, a big gap.
And this gap, I'm guessing, can seriously hamstring a practice, makes it hard to run smoothly, make payroll consistently, maybe even jump on growth opportunities when they appear.
Absolutely. It creates constant pressure.
Okay, so this is where accounts receivable factoring comes in, right? As a potential solution, maybe an alternative to just taking out another loan.
Exactly. It offers a different path.
So let's define it clearly. What exactly is accounts receivable factoring, especially in the context of a medical practice?
Okay, so at its core, accounts receivable factoring is a financial deal. Basically, a business sells its unpaid invoices, its accounts receivable, to a third-party company. That company is called a factor.
Selling future income, essentially.
Pretty much. They sell it at a slight discount, and in return, they get cash right away, immediately.
Okay. And for a doctor's office or a clinic?
For them, it means selling those outstanding insurance claims, or sometimes even the balances patients owe, to a factoring company. Instead of waiting for the insurance check or the patient payment,
they sell the claim itself.
Right. They sell the claim.
Interesting. How does that process actually work, step by step?
It's usually pretty straightforward. Right. Step 1. Your practice provides the medical service, generates the invoice for the insurer or the patient. Standard stuff.
Okay.
Step 2. Instead of just waiting, you choose eligible invoices and sell them to the factoring company.
You choose which ones? Not necessarily all of them.
Often, yes, there's flexibility. Step 3. The factor gives you an advance. This is the immediate cash part, typically around 70% to 90% of the invoice's total value.
Yeah.
And usually fast, like within 24 to 48 hours.
Wow, that quick.
Yeah, it's designed for speed. Step 4, and this is key. The factoring company usually takes over the job of collecting the payment from the insurance company or the patient.
Ah, so the collection hassle shifts to them.
In many cases, yes. That's a
right.
major draw. And finally, step 5. Once the factor collects the full amount, they pay you the rest of the invoice value, that remaining 10 to 30% minus their agreed-upon fee.
Got it. So you get most up front, the rest later, minus their cut.
Precisely.
That does simplify the cash flow equation dramatically. Now, you mentioned choosing invoices. Are there different types of factoring arrangements? Is it always the same deal?
That's a really good question. No, it's not one size fits all. Understanding the difference is important. There are 2 main types: recourse factoring and non-recourse factoring.
Recourse and non-recourse. Okay.
With recourse factoring, if the factor ultimately can't collect on an invoice they bought from you,
Yeah.
maybe the claim gets finally denied for a reason that can't be fixed, or a patient just flat out defaults.
Then what happens?
Then your practice is on the hook.
Yeah.
You typically have to buy back that uncollectible invoice or swap it out for another one. Because you have recourse, the fees for this type are generally lower.
Okay, lower fee, but you retain some risk. Makes sense. What about non-recourse?
Non-recourse is kind of the opposite. Here, the factoring company assumes the credit risk. If they can't collect because the debtor, the insurance company, or maybe the patient goes bankrupt or becomes truly insolvent.
The factor takes the loss.
Correct. If it's an approved invoice and the non-payment is due to the debtor's financial failure, your practice isn't liable. You don't have to buy it back.
That sounds safer, but I bet it costs more.
Typically, yes. The fees are usually higher because the factor is taking on significantly more risk.
Yeah.
But, and this is really important, but non-recourse usually doesn't cover everything. For example, if an insurance claim is denied because your practice made a mistake, like a coding error, or not sending the right documentation.
Ah, if it's your fault, basically.
Right. That kind of issue usually falls back on the practice, even under a non-recourse agreement. It's not a blank check against all problems. Think of it like insurance doesn't cover intentional damage.
Gotcha. That's a crucial distinction. So factoring isn't just about getting cash fast. It's also this strategic element of managing and maybe even transferring some of that payment risk.
Exactly. It's multifaceted.
That is fascinating. Okay, so shifting gears slightly, what does all this really mean for you, the listener, and your practice? We know about faster cash, but maybe. What's the most surprising benefit? Or maybe one that isn't immediately obvious?
That's where it gets really interesting. Because yes, the immediate cash is huge, obviously. But honestly, a lot of practice owners I've talked to are just floored by the administrative relief.
The burden it lifts off their staff.
Immense. Just imagine your team not spending hours chasing down claims, arguing with insurance reps over denials, or making those awkward collection calls to patients.
Yeah, nobody enjoys those calls.
Nobody. So suddenly, that's time your valuable staff can redirect. They can focus more on the patient experience, on making clinical operations run smoother, maybe even on projects to grow the practice.
It's like getting a whole billing department's work done without actually hiring more people.
That's a great way to put it. It frees up your most valuable resource, your people.
That is a massive shift in focus. Okay, beyond just efficiency, what's another, maybe less obvious game changer here?
I'd say it's the specialized expertise that good medical factoring companies bring. These aren't just generic finance companies.
They know healthcare.
The good ones absolutely do.
Mm-hmm.
They live and breathe healthcare reimbursement. They understand payer rules, medical coding, IPA compliance for privacy, the whole 9 yards.
So they're not just collecting, they actually understand what they're collecting.
Precisely. And they often have dedicated collection teams who are trained to be professional, compliant, and, importantly, empathetic, especially when dealing with patients. This can actually lead to better collection rates overall and fewer bad debt write-offs for you.
And fewer patient complaints, maybe?
Hopefully, yes. Plus, they can often spot patterns. They might see why certain claims keep getting denied and give you feedback.
Oh, interesting. Like, hey, you guys keep forgetting this modifier on this type of claim.
Exactly. So it becomes this external check, almost like a consulting service, helping you fix problems in your own billing process upstream.
Wow, okay. That's more than just outsourcing. That's potentially process improvement, too.
It can be, with the right partner.
All right, so expertise is a big one. What about the bigger picture, the overall financial health of the practice?
This is where factoring really shines strategically. First, as we said, immediate capital access, bridging that awful 30, 60, 90-day gap.
Right, the core problem.
So that means you can meet payroll without stress, pay suppliers on time, maybe even get early payment discounts. And crucially, you can invest in growth now. That new tech, expanding services, renovating, you don't have to wait months.
Seize the moment.
Exactly. Second big point, factoring is not debt on your balance sheet. This is huge.
Explain that. How is it not debt?
Because you're selling an asset, your future receivables. You're not taking out a loan that you have to repay on a fixed schedule.
Ah, okay. So it doesn't weigh down your financials in the same way a loan would.
Correct. It can actually improve your debt-to-equity ratio. It keeps your borrowing capacity open for maybe a big future need, like buying property. And there are no fixed monthly loan payments, just that fee taken out when the invoice is paid.
So the funding scales up or down with your actual billing.
Precisely. It's flexible.
Yeah.
It adapts to your patient volume naturally. More billing means more potential funding available.
That's a really compelling set of advantages. Immediate cash, less admin burden, expert help, better financial ratios, flexibility.
It covers a lot of bases.
But, okay, let's be real. Despite all these pluses, practice owners listening might still have some hesitations, right? Some perceived downsides. What stands out to you as the most common concerns people raise? And, how valid are they really?
Yeah, absolutely. And the number one concern almost always is the cost. The factoring fees.
Right. It sounds great, but what's it going to cost me?
Exactly. And those fees are real.
Yeah.
They're typically a percentage of the invoice value. How much depends on things like your total invoice volume, how quickly your payers usually pay, the average size of your invoices, and importantly, whether it's recourse or non-recourse.
So lots of variables.
Lots of variables. But here's the thing. You really need to reframe how you think about that fee. It's not just an expense line item. It's more like an investment.
An investment in what?
An investment in efficiency, speed, and reduced risk.
Yeah.
You have to weigh that fee against the cost of not having the cash. What's the opportunity cost? Meaning, what discounts are you missing from suppliers because you can't pay early? Are you paying late fees to vendors? Are you delaying buying that new piece of equipment that could generate more revenue? What's the cost of your staff's time spent chasing money instead of on patient care?
Ah, okay. The hidden costs of waiting.
Exactly. And then factor in the administrative savings. Maybe you don't need as large a billing team. Plus, a good factor might actually increase your collections, especially on tougher accounts, and reduce your bad debt write-offs.
So the net benefit could easily outweigh the fee itself.
Often, yes. When you look at the whole picture, it frequently does. You just have to do the math for your specific situation.
Okay, cost is one. What's another common hesitation?
A perceived loss of control, particularly over collections. Practice owners worry about handing over that relationship, especially with patients, to a third party.
Yeah, I can see that. You build relationships with patients.
Definitely. But reputable medical factors understand this. They know they're representing your practice. They should operate with total transparency, giving you clear reports, dashboards, so you always know the status of your accounts.
So you're not in the dark.
You shouldn't be. And their collection approach, especially with patients, should be professional and aligned with your practice's values. Again, this comes down to choosing the right partner. But the goal isn't to take control away from you, but to free you up from the tactical work so you can focus on strategic control and patient care.
That makes sense. It's shifting where you apply your control.
Exactly.
Okay, what about just general reputation concerns? Maybe the word factoring sounds a bit, aggressive, especially if they are collecting from patients.
That's a valid point, and it stems from maybe experiences with general consumer debt collectors, which can sometimes be overly aggressive.
Right.
But it's crucial to differentiate. Specialized medical factoring is different. These companies are dealing with insurance claims primarily, and when they do interact with patients about balances, the good ones are trained to be professional, empathetic, and compliant with all regulations like the FDC-TILO.
So it's not like sending the heavies after Mrs. Jones for her copay.
Absolutely not, or at least it shouldn't be with a reputable medical factor. Their goal is to facilitate payment smoothly and maintain goodwill, because they want your continued business too. And honestly, sometimes having that third party handle the financial conversation can actually improve the patient experience.
How so?
Well, it provides clearer billing sometimes, a dedicated point of contact for financial questions, rather than tying up your front desk. And it keeps your clinical staff out of potentially awkward money conversations. They can focus purely on care.
Letting the clinicians be clinicians and the financial folks handle finance.
That's the idea. But again, due diligence in choosing your partner is absolutely key here to ensure their approach matches your practice's philosophy.
Understood. So these concerns, while understandable, often have strong counter-arguments or solutions, especially if you partner wisely.
That's generally the case, yes.
Okay, this is all great context. But to really make it tangible, let's walk through some hypothetical but realistic scenarios, like mini case studies.
Absolutely. Real-world examples help connect the dots.
Mm-hmm.
Let's imagine, say, Kids Care Pediatrics. It's run by Dr. Chen, and she's doing well, wants to expand, open a second location.
Common scenario.
Very common. But even though patient numbers are up, cash is tight. Why? Slow insurance payments may be averaging 70 days, plus all the upfront costs for setting up the new clinic,
Yeah.
rent, equipment, staffing.
Right, the expansion paradox. Busier, but broker temporarily.
Exactly.
Yeah.
A traditional bank loan might be slow, require collateral she doesn't want to tie up. So,
Yeah.
Kids Care partners with a medical factor who really understands pediatric claims. They decide to factor, say, 85% of their eligible commercial insurance receivables. Within 48 hours, they get a significant cash advance. This lets Dr. Chen move forward confidently, with the second location signing the lease, ordering equipment. Meanwhile, the factor handles chasing down hundreds of those relatively small pediatric claims from multiple insurers.
Taking that burden off her staff.
Completely.
Hmm.
Her staff can focus on patient scheduling, coordinating the move, ensuring a smooth transition, cash flow becomes predictable, assets aren't tied up as collateral, and Kids Care opens location number 2 successfully.
Nice. Okay, give us another one. Maybe a different type of practice.
Sure. Let's think about Dr. Davis at Summit Internal Medicine. An established practice, good reputation, but he's seeing more and more patients with those high-deductible plans we talked about.
The patient responsibility issue again.
Right. His billing staff is drowning in trying to collect these patient balances after insurance pays. It's inefficient, and their bad debt is creeping up.
So what's his move?
Summit decides to use factoring, but maybe just for the patient receivables portion. They might choose a recourse arrangement here, maybe getting a slightly lower fee since they're retaining some risk. The factor takes over all patient billing, sending statements, handling calls, processing payments.
Professionally, hopefully.
Professionally, empathetically, yes. The result, Dr. Davis's staff is freed up. They can now focus on verifying insurance up front, improving front desk interactions. Collections on those patient balances improve dramatically because there's a dedicated effort. Cash flow stabilizes, bad debt drops, staff stress goes way down.
So targeting a specific pain point patient collections with factoring.
Exactly. It doesn't have to be all or nothing.
Okay, one more. Maybe something involving complex claims.
Good one. Let's picture OrthoCare Sports Medicine. Busy orthopedic clinic. Lots of surgeries. Their big headache is insurance claim denials. Complex surgical coding, maybe missing documentation. It happens a lot, and it creates serious cash flow delays while they appeal.
Appeals can take forever.
Months, sometimes. And this delay is stopping them from investing in some needed new surgical tech. So OrthoCare partners with a non-recourse medical factor that specifically specializes in complex orthopedic and surgical claims.
The specialization is key there.
Absolutely. This factors team knows ortho coding inside out. They review claims before submission sometimes, catch errors. They take charge of managing any denials, handling the appeals process expertly, OrthoCare gets their advance immediately instead of waiting for that appeal to resolve.
And the non-recourse part helps how?
It transfers the credit risk. If, after all appeals, a claim is ultimately uncollectible due to, say, payer insolvency or some other covered reason, OrthoCare isn't on the hook. Plus, the factor provides reports identifying why claims were being denied initially.
Ah, that feedback loop again.
Right, helping OrthoCare fix their internal processes. So, end result, cash flow smooths out, risk is reduced, they get operational insights, and they finally buy that new equipment.
These examples really drive home how versatile factoring can be. It's not just one thing. It can be tailored.
Very much so.
Which leads perfectly into the next crucial question. If you're listening and thinking, okay, this sounds interesting, maybe even necessary for my practice, how do you choose the right factoring partner? This seems like a decision you really need to get right.
It is absolutely critical. Your success with factoring hinges on this partnership. And the number one non-negotiable thing, specialization.
Healthcare specialization.
Yes, specifically in healthcare accounts receivable. A general commercial factor just won't cut it. They won't understand CPT codes, IPA, Modifier 59, dealing with Medicare. You need deep medical billing expertise.
Okay, specialization first. What else?
Reputation and experience are huge. How long have they been doing medical factoring? Ask for references and actually call them. Talk to other practices like yours who use them. Check their reputation online, Better Business Bureau, etc. Are they known for ethical
Some
practices?
due diligence on their track record.
Yeah, absolutely. Then transparency is vital. Get everything in writing and make sure you understand it. What's the exact fee structure? How is the advance rate calculated? When and how is the remaining reserve balance released? What's the contract length? Are there minimum volume requirements? And be crystal clear on the recourse versus non-recourse terms and what each covers or excludes.
Read the fine print, basically.
Read all the print carefully. Next, scrutinize their collection capabilities. Do they have their own experienced in-house team, or do they outsource it? How good are they at denial management and appeals? Do they have existing relationships with your main insurance payers? That can sometimes speed things up.
And if they handle patient collections?
What's their philosophy? How do they communicate? Does it align with your practice's patient-centric approach? You need to be comfortable with how they'll represent you.
Makes total sense. Anything else on the checklist?
Definitely look at customer service and communication. Will you get a dedicated account manager who understands your specific practice? How responsive are they when you have questions? What kind of reporting do they provide? Is it timely, detailed, easy to understand? Can you see the status of your accounts easily?
The ongoing relationship matter.
Hugely. And finally, consider the factor's own financial stability. You want a partner who's solid. Their scalability, can they grow with your practice? And their technology platform, it's secure, IPA compliant, maybe integrates with your practice management system?
That's a comprehensive list. It really underscores the need for thorough vetting.
It really does.
So the practical advice seems to be, get proposals from a few specialized medical factors, check those references diligently, review the contract with a fine-tooth comb, maybe even have an attorney look at it, and if it makes sense, perhaps start with a smaller pilot program to test the relationship before going all in.
That's a very sound approach. Dip your toe in, see how it feels.
Okay, so wrapping things up. What we've really unpacked today suggests that accounts receivable factoring is, well, potentially much more than just a quick fix for a temporary cash crunch.
Oh, absolutely.
It seems to emerge really as a strategic tool, maybe even a strategic imperative for practices trying to thrive in today's, frankly, challenging healthcare financial world.
I think strategic imperative is a good way to put it. It's a sophisticated financial instrument that directly tackles those unique pain points we discussed. The reimbursement delays, the admin burden.
Right.
It delivers that immediate liquidity, yes, but also accessible financing that isn't tied to your credit score in the same way a loan is. It improves financial health metrics, brings in that specialized billing expertise.
Scalability, potentially improve your actual collections, reduces bad debt, mitigates certain risks.
Exactly. It's a whole suite of benefits working together.
And by embracing this kind of tool, it seems like medical practices can unlock that capital that's just sitting there, tied up in unpaid claims.
Liberate the capital, yes.
Which then empowers them to do what they really want to do. Invest in the latest technology, expand their services, attract the best staff, and ultimately just focus more energy and resources squarely on patient care.
That's the end goal, isn't it? To remove the financial stress so you can focus on medicine.
It really is.
Yeah.
So maybe the final thought for you, our listener, is this. What would it truly mean for your practice to be financially healthy, really robust inside and out? What could you achieve if you could prioritize the very best patient care without that constant cash flow worry hanging over your head?